Good afternoon all. I am Dr. Jaideep Khare, endocrinologist from Bhopal. We have international faculty, Dr. Roma from USA, Michigan. She will be talking and discussing about the management of diabetes in chronic kidney diseases patient. So, to ma'am, as the prevalence of chronic kidney diseases is increasing in present time, do you see that the diabetes has some impact on this increase in the prevalence?
Sure. So, as you know well, that diabetes is the commonest cause of chronic kidney disease worldwide. In some countries, about 40%. Although the incidence of diabetic nephropathy is reducing, but the prevalent cases are so high that the whole burden of diabetes kidney disease is getting higher and higher. And it's an extremely expensive disease, especially when patients go towards dialysis. And therefore, not only the burden of the disease, but the cost of the disease is also increasing worldwide.
Yes. And ma'am, as the management of diabetes is itself a complicated thing. So, how do we manage the diabetes in CKD patients in early stages or late stages?
Sure. So, the pathophysiology is very different. In early stages, there's a lot of insulin resistance. And as patients go through the disease, patients get more and more insulin sensitive. So, you have to use medications carefully as patients are progressing and actually monitor the disease through the course. So patients actually and physicians are unaware often that they have kidney disease in the early stages. So sometimes you start medication which can accumulate in the patient as the kidney disease is progressing. So early on you're dealing with insulin resistance and hyperglycemia, and then later it's hypoglycemia. So there's got to be some good. Also, your A1C goals will have to change. In early disease, you want to prevent worsening, so you want tighter goals around 7%. And as the patient gets sicker and older and more comorbid, then you want to relax your goals a little bit to like 8 or 8.5% to prevent hypoglycemia.
Yes, ma'am. So, are there any medications which can prevent the progression of nephropathy in diabetic patients or reverse them?
So we are lucky now, we have all these new trials coming out, and we just heard many talks here about that. The older drugs, the sulfonylureas, metformin, etc., did not have this benefit, but the newer drugs, especially the SGLT2 inhibitors and the GLP-1 receptor agonists, are showing more and more that they have improved renal outcomes. So this is an exciting time where you can only also control the glucose and also prevent worsening disease. So unfortunately, all the trials are not out, but I think by 2022 we'll know exactly how the SGLT2s and the GLP-1s can prevent progression. So they're an exciting addition to this drug market for for diabetes and kidney disease.
Thank you, ma'am. Thank you, ma'am. Thank you for enlightening us for the management of diabetes in CKD patients. Thank you.
Thank you.